Hello and welcome to the Psyched to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Paul Wagner, and joining me is
Ray Christner.
And again, wanting to do another bonus episode here in response to the recent update and announcements that have been coming out surrounding autism, different causes for autism, different treatments for autism. And as we're digesting it, wanting to share some of our thoughts and provide some feedback.
Yeah, I mean, I think that, everybody kind of was anticipating this announcement from the White House and HHS. And, I think it came with a lot of anxiety, maybe a lot of anger, maybe a little hope that was there. But I think the pre-announcement emotions were maybe even stronger post-announcement. And, and I'm sure, we both probably have heard things. But yeah, for me, I thought like maybe talk a little bit maybe about our reactions and then, like you said, kind of maybe digest this and dissect it a little bit. So what was your reaction, Paul, when you kind of heard the announcement?
Well, I should first say that my exposure to the announcement was a little bit of that. This is coming down the pipeline. However, I didn't actually watch or listen to those direct announcements. It was only in reading some of the following articles. And I have since then, but some of those initial reactions, one of them was really just kind of I think disappointment.
Yeah.
And especially how it was being presented. Also, I think it really, it puts this group of individuals with autism really in this negative light. And also, I think in some of the recent interactions I've had with some clients who have talked about it, really feeling that they're targeted in this way that says, there is something fundamentally wrong with you was some of the message that I was hearing. And so I think a lot of my reaction is also hearing some of their anger, some of their frustration and concern. I think because, we're making some causal claims that I don't know that we have the research to accurately identify that. I do think it is certainly something that we should be looking into more, researching more. But I think that this feels like it was jumping the gun a bit.
Yeah. Yeah. It's, so kind of similar. I mean, I think that I was probably following it maybe a bit more waiting for the announcement, trying to really, I didn't see it live, but, I guess there was a little part of me that was like, okay, this could be an opportunity for the government to make maybe a good announcement. And I think my reaction, I think you used the word disappointment. I think, I felt like missed opportunity was my initial reaction. But for me, it was kind of interesting. And I don't have a better word than that. My reaction was bimodal, meaning that on one hand, there was this missed opportunity and maybe myself having a little anger because I do value research. And I think that, for lack of a better word, it was bastardized in the moment where it was like, wait, this is not, we're giving the wrong message. But the other side, I guess, mode for me was that also I think that there was maybe a little bit where it was like, okay, if we read between the lines a little bit, I'm glad we're looking at other things. I because I like research, the other part of it is I also recognize research is wrong. How many times in my 30-year career have we said what research says, and then 15 years later going, oops, we were wrong, and we kind of backtrack then. And so there's part of me that didn't mind the fact that we're taking deeper dives into things, and even between the lines, hearing hey, it's between moms and their doctors, and we should talk about it and talk about the use of it and what's right and what's our body type, what's the right thing. And part of what I got into was, again, Tylenol. We've all heard studies about there are some liver effects if you take too much. So part of me is like, that doesn't happen to everybody, but we're all unique in how we process things. And some people may be more at risk than others. And that should be a doctor-parent decision. I'll add one other thing, and that is, you talked about your clients kind of being put in the spotlight. I think the sad part for me was, I think moms. I mean, I sat there and kind of went, here we go, where we're actually, I felt like we're blaming moms. Yeah. And it was, and that's been historic, right? I mean, we see this in things. We've seen it with autism, years ago. And, my concern is we'll have moms that will suffer or have
Yeah.
guilt. And we just don't have enough data that is anywhere where we should be going. But I thought about all the moms that I work with as I heard the message, because I thought that was a difficult thing for them as well.
I'm grateful that you said that, because I think one of the ways that I interpreted it being presented is that this is the direction that you need to be moving. This is really, if you're not adopting this now, you soon will be, was kind of the message that I took. And I did take away that it was encouraged as a conversation, but that there was almost an anticipation that there will be this follow through, or there will be this trend. And I'm not familiar with all the studies, like from the bit that I have, I'm seeing different studies that are contradictory. And one of the things, though, that in the studies that I am, is that it's a relationship. And I think that correlation versus causation piece of it is such an important thing. And yet I think the way it was presented was more causal. And that's a dangerous statement to make without really clarifying that piece.
Oh, man, I think you hit the nail on the head. That's where my anger, I think, came in, and the missed opportunity. I think, again, I look at all these things sometimes as like, we have an opportunity to educate people, and then we miseducate people. But so maybe let's take a little bit of time, Paul, and talk about the correlation versus causation piece of this argument. So, I don't know, maybe let's address it in kind of, I don't want to say a fun way, because I'm going to give a really disturbing, fun example. But, one of the things that we know in research with correlation, or what one study has shown, has been that the higher the amount of ice cream that sells, the higher number of drownings that occur.
See, I've actually heard the research behind the higher ice cream sales and higher shark attack.
That is actually true as well. So, it sounds like silly examples, but it's a great, I think, illustration of this idea that we can all logically say ice cream has no relationship to drowning or towards shark attacks.
Unless those sharks have a sweet tooth.
Well, that is a possibility, I guess. But so there's no causation in that. Like, there's no causal relationship. But why is there the association, right? So we sell more ice cream in the summer months, and more people are in water, which increases drowning chances, and it also increases shark attacks. So so when we look at these things like correlations, we have to be cautious. And, this study that I think this decision was made off of is a great example. Again, correlation. But even the authors, and I'm going to just read the authors of the study that this whole press conference was about. What they ended up writing at the end is, our analysis demonstrated evidence consistent with an association between exposure to acetaminophen during pregnancy and off-screen with neurodevelopmental disorders, including autism and ADHD, though observational limitations preclude definitive causation.
Yeah.
So that's it. So again, why I like research is we see limitations, and the conclusion of that study highlights that. And so, but we missed that, I think.
And, for those of you that are listening, to even just kind of take this idea further, when we're talking about a correlation, really what that is it's a relationship. And so the example that Ray gave earlier, that would be something we'd recognize as a positive correlation. So as one is going up, we see the other going up. There's also negative correlation. As one is going up, the other is going down. And so I would say every causal relationship has a correlation along with it, but not every correlation is causation. And so we have to be really careful when we're making these assumptions, because we can just look at the data and we say, oh, well, these are increasing. And our brain really jumps to saying, well, one causes the other, but we really need to take in those other considerations. And so, Ray, I believe you were earlier saying about how, some of these studies are noting a pretty significant trend, yet when there's a control for siblings, then we see that falling off. And so again, when we're introducing new data to make a comparison point, such as being in the water more during the summer when ice cream sales are going up, we see that ice cream is causing shark attacks or drownings really falling apart there.
That's right. Well, and so with that research about the siblings, so that study, and there's we could probably put these in the show notes, I think, if people are interested. And I know these are probably flying all over the internet anyhow, but it's not an old study. It's 2024 a Swedish research team. When we look at research, right, sample size is important. They look at 2.5 million children. Of those, 186,000 were exposed to acetaminophen during pregnancy. So first glance, about 5 to 7% had an increase of autism. So again, we see an association. We see that happen. But they then dug further, and when they compared to siblings, one exposed to acetaminophen and one not, to control for the genetics and the environment, that association completely disappears. So that's where, if we don't do interpretation of research adequately, we can get ourselves into some difficulties. The other thing I just want to kind of mention is, again, and probably people have heard this through social media channels or whatever, but the other piece, when we start looking at causation, autism's not new. So, and we know that it changes in how we define and all of those things. Tylenol was invented in 1955. Autism was named. So sometimes we hear like first appeared. It didn't first appear in 1943. That's actually not correct. It was named then. But we can go back to 1999 when there's the first documented case of what probably would be autism today. And it was by a clinician, Jean Itard, who is a French clinician. And there is a movie that is older than I am. So this is how old this has been out there. But it's The Wild Child is the name of the movie. And it is, when you kind of watch the movie, you get the sense this was actually probably a case of autism with very high support needs. And there's a lot in this whole situation. But my point is, we weren't even thinking about Tylenol.
No.
And we have historical cases where when we look back, we can retrospectively say, oh, this probably was a neurodivergence of some point. We may not have the name for it. So it's kind of hard for that to be the cause if we've had a history of knowing cases that are out there.
And the pieces that I think are really important for us to recognize, and this is maybe an argument on the other side, like I do think more research is needing to be done.
Sure.
And if we're talking about, what effect does that have in terms of symptom severity? So maybe not even the causation, but like I haven't specifically looked for this, but in terms of what's being shared out and around, I haven't seen that piece of it. I've been seeing the arguments for this claim that it's causing.
Right.
And really, again, the history that Ray just shared from the sibling studies that really challenge some of the assumptions that are being made here, we're making causal statements that we just don't have the science to back up.
Yeah, I agree. And I kind of started out saying, my bimodal kind of reaction, disappointment in the message. So glad that there's exploring other things. And, I think that's my hope. I think at the end of the day, autism is complex in many ways. I've worked with, I don't even know how many individuals, and autism is different every time that I work. There's a very individual aspect to it. And I think that when we try to narrow it down to this single cause, it doesn't do anything. Should we be researching and helping to understand? Absolutely. And, I guess the other piece that was part of that announcement was this idea of Bucovarin as, for an unfortunate use of words, stating it as a cure. One, I'm not sure we're trying to cure anything, but is it a possibility to maybe help some individuals? Possibly. I think that, I only had one person that I've been involved with that way before this announcement, because this is an autistic adult who really had a lot of needs at that point in time, some aggression, did not talk very much, limited communication, and a lot of self-harming behaviors. And honestly was on a cocktail of psychotropic medications that I really wouldn't want to see anybody on. And this individual's doctor was familiar with leucovorin and they started it. And it's been a game changer. Takes no other medication and is doing exceptionally well, still has support needs, but it's really been a game changer for this family. But that's an N=1 study.
Yeah.
I mean, and I have no other comparisons to make. It just happened that for that individual, it worked. And it wasn't that parents just randomly went to the doctor and they wrote a prescription. There were blood tests involved. It was a really a complex process. And I'm grateful that that doctor was able to help provide an opportunity for more comfort in this individual's life. And I think it's wonderful. But here we are talking about this medicine. It also doesn't have much research behind it. We don't have a lot of studies. So there's a lot of questions in my mind, safety of this as a treatment or as an intervention of any sort. Again, I hope individuals talk to their doctor. I hope that's the right message that keeps coming out, but still a lot of questions about it.
And I think that going back again to this causal claim, we have Tylenol is causing autism. And we also then are making, a claim that is leucovorin causes a cure.
Right.
And, we have a study of one that recognizes not a cure, but a tool and a good support.
Yeah,
but
great quality of life change.
We really want to be cautious with that because just because it's a 1 out of 1 does not then mean when we increase that sample size that we're going to see that same effect broadly. And so I do think it's something, again, warrants more research. And I think that's the piece that, for me, I think the silver lining I take away is, I think it is sparking a lot more focus and I do hope it then generates more research so that way we can have a better understanding. And I do hope glucoverin ends up being a really effective tool, but I'm going to be really hesitant to say that until I'm, seeing far more evidence to support that than is out there right now.
I think that's a key. And I do hope that, part of that message was that there was going to be research funding that was going to be put in place. Not trying to be political here by any means, but that hasn't been consistent with this administration to support research. And we've had good research that got stopped because of lack of funding. I hope that that's true. I hope, because honestly, if we could have anything that would be positive is let's keep researching. Let's keep looking at how we support individuals. I think that's awesome. I'm not sure we're looking for a cure, but if we can find things that improve the lives of individuals, great. If we can understand neurodivergence better, wonderful. I think those are all good things, but that takes consistent fundings. I don't know. I hope. Time will tell on that one. As we kind of wrap up, I want to. I think maybe how we should kind of end or kind of think through this is. I'm just kind of curious, Polly. How are you responding to questions clinically about this? So I know I've had some people this week who have reached out, some parents, moms specifically, who ask questions about, do you think Tylenol affected my child? I've had a few adults that have had mixed opinions and mixed thoughts. But so how are you addressing it clinically?
So I haven't had any moms that have brought this up. The two individuals that it came up in session this week, both are adults who, I think overall function very well. And they were both angry. And so I haven't necessarily had that direct question of, do I think that they should or shouldn't do this? It was more, can you believe this? And so it was meeting them kind of where they were at. And I was questioning. I was like, hey, so what are the sources that you're looking for? And really trying to encourage, how do we be mindful of the sources of information? So I think that was something that we were talking about and discussing. And, just so happened, I think it was earlier that morning, I had seen a post from the APA just kind of in response to this. And so we were talking about different trusted sources that we can look to. And really, again, that ones that aren't discrediting it from this lens of that can't be true, but rather are looking at it from this lens of they're making a causal claim that we don't see evidence that supports at this time.
Yeah.
Because I think, again, that's going to be in alignment with what the current research says. We're really wanting to, like, that was my message to them is, hey, be mindful, because we are going to get messages out there that like, this is 100% not true. And I think the message that I was sharing with these two individuals, and very similar messages, like, be cautious with the sources of information, even like, again, trusted sources, different information that's attached to that, or different messages that are attached, if we're reading through comments and things like that piece. So that was really my own personal experience. If a mom does come up and talk to me about what do I think, or, what would be my recommendation, it is going to be talking with her doctor. It's going to be encouraging having an open conversation.
Yeah, I agree. Yeah. So, I mean, my response has been, for the adults, kind of similar to kind of what you had said. For parents, I kind of like you, I kind of looked at it and just said, listen, what I've read in the research is that we're not seeing a causal link. Are there some questions? Sure. That's why we keep researching things. But medical decisions should be made with a physician that you trust, and a discussion, and they should hear you out. And I'm going to refer you back to them and really have a discussion and be open about that discussion. And more important, for those parents whose children I have, the opportunity to be part of their lives, I also just kind of said, listen, our focus right now isn't to go backward. And listen, there's a lot of shoulda, coulda, wouldas, wondering about this or wondering about that. But we kind of have a cool kid that we need to really kind of keep fostering their strengths and support their needs. And how can we stay with that right now and look at what's the best opportunities that we can control in the moment, and really kind of focusing on that. Because it was interesting. I'd said that just this morning to a mom, and she's like, oh my gosh, I lost focus how wonderful my kid is. And I went, yeah, right. Like, yeah. We don't want to change that. He's a really cool kid, and that's what makes him great. Like, I mean, it's like there's great parts, but it's so easy to get caught up. And I get it. And it was interesting, because it was like I said, she was like, oh my gosh, I wouldn't want my life to be different, but it's easy to get in your own head about these things, right?
Absolutely.
So, I mean, that's it. And I mean, I think that we, just kind of going back to, hey, I hope we keep finding things out, and not losing the fact that science, a little bit of knowledge of science is really dangerous.
Yes.
And the people who probably know it best are the people that you work with professionally. And that's where those discussions should go.
And, I think that is such an important message. And again, in the same way you're talking about, mothers going and talking to their physicians, I think if you have questions, go to professionals, being able to talk to them, getting their support and translating some of these pieces and some of these messages, and that's not to discredit, go and pursue your own understanding of this,
right?
But make sure that when we have an initial understanding, we're not kind of touting that as like, oh, I have full understanding. And I can at least speak personally. When I took my first intro to psych class, I was like, I have everything figured out. And I took the next fall class and I was like, I have nothing figured out. So getting a little bit of knowledge can be dangerous.
It is. And I think that I have a feeling we're going to hear a lot of news moving forward in a whole bunch of directions with this. And, I think, again, kind of taking it, listening to it, and, trying not to react before we listen. But when we hear something bad, it's okay to react. Yeah, if that makes any sense. And that's kind of been my view, is like, again, there's two parts, I think, to it. And we have to just kind of pause for a second and digest it. And, for me, I had to step away from the social media cloudiness of it, and really, sat back and went, okay, I'm going to look up some journals. I'm going to read these things. And I wasn't not trust the news, but I even didn't want to do that. Like, it was like I was getting all these sound bites instead of going, okay, let me look at it and digest it on my own a little bit. And then after that, I think that was a good reset for me. And so as we do this, don't listen to sound bites, take a moment and I think process it. And professionally, we should all be doing our due diligence.
And, thank you so much for listening We'll be back. But until then, be well, stay psyched.